Hi everyone. I'm glad to be the voice of our group talking about our paper topic, sympathetically mediated pain. Our group was Eddie Bettinall, Natasha Herman, Jan Robbins-Chant, and me, Melanie Johnson. The objectives for this session is for me to provide actually information about the definition of sympathetically mediated pain, to identify possible mechanisms of sympathetically mediated pain. You'll find that this is not as easy as one might hope, and also to identify controversial areas and unanswered questions, and there are quite a few of those. And certainly the most important thing is to reflect on implications for treatment of the patients that we encounter who have chronic pain and potentially pain that might have a sympathetically mediated component. As I mentioned in the objectives, we'll start with a definition of sympathetically maintained pain, which will give us the focus for the rest of this discussion. This term was first used in 1986, and it was used while explaining the physiological basis for causalgia, which was a previous name for complex regional pain syndrome and other related pains. So the definition at that time was sympathetically maintained pain is characterized by past physical trauma to the painful area, continuous burning pain, and mechanical hyperalgesia or allodynia, and relief of pain by sympathetic blockade. So sympathetically maintained pain can be thought of as pain in the periphery that occurs when there is stimulation by the sympathetic nervous system. And this slide gives you an idea of all the different things that the sympathetic nervous system does, in contrast with what happens with the parasympathetic nervous system that's also included on this slide. And I'd like you to focus on the sympathetic nervous system, and near the bottom you'll see the mention of secretion of adrenaline and noradrenaline, which happens with sympathetic stimulation, and that will be important as we discuss the mechanisms of sympathetically maintained pain. Certainly sympathetically maintained pain is a unique condition that occurs in certain situations and implies an interaction between the sympathetic nerves and nociceptive sensory nerves in some disease states. And there certainly isn't this interaction between the sympathetic nervous system and the nociceptive nerves in normal uninjured tissues and for normal patients that are not injured. And certainly it's also important to understand that all pain is not sympathetically mediated.